It used to be what's helpful or not helpful about the session. And nowadays it's just, was there anything that didn't go well in the session today? Welcome to Be Kind to Your Mind, a podcast brought to you by People Psychological Solutions. Here, we bring the latest mental health news and research while providing you key insights based on our own clinical experience. My name is Alvin, and I'm your host for today. Why do some clients complete therapy and some do not? A contributing factor to the failure of treatment for mental health concerns are clients who prematurely discontinue sessions. On average, 35% of clients who attend therapy sessions do not complete them. This limits the benefits to compare to if they complete the sessions accordingly. So, what are the reasons to this? To discuss this matter in detail, I'm joined today by a clinical psychologist from People, Serene Tan. To start things off, Happy New Year.
Happy New Year to you too, Alvin.
How was your New Year celebrations?
New Year for me this year is quite simple. I just had a group of friends to come over to my place to have a dinner together. Yeah, just a simple and a warm one. How about for you?
As you know, I was celebrating it, shivering and lying down on bed. I was down with influenza, quite a bad one. My family as well.
Yeah.
So that's how I started my new year.
Oh boy.
But anyway, to kick things off in the new year, we are starting off with this podcast, Be Kind to Your Mind. And before we get into our topic for today, perhaps an introduction to perhaps your professional experience, background. Let's have the audience informed on who you are as a psychologist.
Alright, okay. Hi everyone, I'm Serene and I'm a clinical psychologist that I've been practicing for 5 years already, and also recently I'm also a clinical supervisor supervising clinical psychologists in training. So my main topic of interest, or the usual clientele that I usually see, are people who struggle with mood disorders like depression, anxiety, or stress related, or people who struggle with relationship issues like trauma, abuse, grief and losses, or people who struggle with self-esteem issues. So I also provide couple and family therapy also.
Okay, so it does sound like you do provide therapy services for people experiencing a variety of different clinical concerns.
Mm-hmm.
And the reason why you're here, Serene, is because our topic on today is regarding client dropouts. And knowing you historically, you have been with the office for the past 5 years now. Generally, you manage your clients pretty well. So clients are happy to receive services from you. And we wish to delve into this matter a little bit more.
Okay.
Because in an ideal world, if clients were to continue for sessions, you're looking at a minimum of 8 to 12 sessions to receive quite good benefits from the therapy. But when we look at the evidence, and I'm referencing here to a literature review by Roos and Wilbert in 2013, a weighted average of about 35% of clients do not complete their therapy sessions, which means that they wouldn't be able to receive the kind of benefits of therapy that we know of from the clinical research. So, what are the reasons to this? Some of the cited reasons are, for example, therapist experience, training and skills, lack of provision of concrete support, not being emotionally supportive, a poor quality of therapeutic alliance, client dissatisfaction, and pre-therapy preparation. These were some of the reasons that may or may not, may likely affect or influence the dropout rates. Yeah. Now, I might not have mentioned it, or maybe it is one of the reasons that I had earlier mentioned. But what do you think, as a therapist, could be the most important factor that affects a client's dropout from therapy?
Most important factor. I think definitely there are always a variety of factors that combine and interact together. But if I were to sum it up, I think it's always about whether is it a good fit between the therapist and the client. So like it would be a combination of like a client factors and also therapist as well. Because like the good fit between the client and the therapist usually predict a better therapeutic alliance, and in terms of like setting the goal for the therapy, and also they will be working together. Client feel like therapists meet their needs, and also therapists can have a relatively good grasp of the understanding of the client's issues, and then also can provide an interventions that best fit the client's presenting issue, and also like the goals that they wanted to achieve. So I feel like the good fit between them, if I were to sum it up, I think it's quite important factor lah.
So, Serene, I think you brought up a good point about having a good fit between therapists and clients. I'm a little bit mixed about that because by right, our training should be able to equip us to handle clients from a variety of different backgrounds. Could you tell me more about, what do you personally mean by having a good fit between therapists and clients?
It can really stem from many different aspects. So the first thing is that like usually lah, because I usually would think from like the client's perspective to see that what they're actually looking for in like a psychologist to become their own therapist lah. So like from a client standpoint of view, firstly probably I would think that like, okay, what are my issues or like my concerns? And like then from there on, then like I will want to look for a therapist that may have relevant experiences in that area. Then the second thing, as a client, I think I would want to then also look at like the therapist personality. I know that like of course just at like first glance, I can't really tell, right, the therapist's personality, but it's just like, like sometimes through the pictures, actually they can already tell what kind of a vibe the therapist is actually sending out. So like when they go in, then like a certain clients actually look for like some therapists who is like maybe more listening type, asking like some of the more open-ended probing questions. Some actually look for like the experted, like like a therapist who is like having certain expertise in certain area. Then the therapist come from like telling you or guiding you with like a certain techniques, or like like psychoeducate you, how you can go about like the more practical or solution type one. So it really depends on like these are the factors that the client will actually look into, and then like whether the therapist is actually confident in doing this. Well, at the same time, I definitely agree with you that like we as a psychologist, we are being trained in like being able to actually fulfill client needs, like in terms of like all of these like paradigms that I just spoke about. While it's just that because some therapists it's more comfortable with certain style, also like maybe having more experience because of maybe their keen interest in certain areas. So like it's just like this will become a better fit for the clients lah.
So you brought up a few things there, and what I can agree with, that will be a difference between therapist A and therapist B would be in terms of working experience. So it's going to be quite clear. For example, some therapists maybe they might have more experience working with couples. Some therapists might have more experience working with a more specific clinical concern, maybe with OCD, trauma, and so on. So on the basis of experience, it's quite likely a client will be able to make that judgment. I'm able to choose someone who is more experienced to handle my presenting concern, which can be different from another potential client. So if I am meeting someone who has a lot of experience working with trauma, I'm expecting that this particular therapist will be more competent than someone who doesn't usually work with trauma.
Yeah.
So I think experience is something that I can agree with, that clients can actually make that kind of judgment. But on the other hand, and again, I'm playing a bit of a devil's advocate here. What you've mentioned about asking, open-ended questions or providing information, all those are skill sets that are meant to be developed by the therapist. So how do we actually navigate a discussion where the clients can actually feel like they are being heard effectively? Or how do we actually ask the right questions at the right time? And how do we actually provide the right kind of information that's going to be helpful for them? So I'm going to sort of put this on the part of the therapist, where there is definitely going to be room for improvement for every therapist in order to better work with their clients, because all this does affect the client outcomes. And I'm going to refer to the term therapeutic alliance, and this is something that we freely throw around in our circles, whether the alliance is strong or not. Do I have a good therapeutic alliance with my client? What this means for the audience out there listening is this general sense that you as a client are able to work very well with a therapist. So this is something that is defined as therapeutic alliance. Now, for a lot of therapists that I've spoken to, when they refer to the therapeutic alliance, they're oftentimes referring to the more subjective definition of therapeutic alliance. How warm or how comfortable or how much of a bond do I actually feel with my client? And that's going to be, I think, one important aspect to consider. But a lot of us forget that therapeutic alliance is defined not only by the emotional bonds that we have with our clients, but also whether or not we have an alignment or shared goals in our sessions together, as well as shared tasks. This means that both client and therapist are able to agree on the things that are to be done as part of therapy, and that they are able to agree on the goals to be accomplished in therapy. And I think these are the two things that likely can be fixed, can be addressed by the therapist, rather than the emotional bonds, which, for the most part, might have to rely more on individual style and personality.
Yeah.
What are your thoughts on that? I think, I brought up my point that the therapist would need to put in the work, rather than to rely on explanation of more of a personality or personal style in determining a good fit.
Yeah.
Right. So I want a good fit with my clients. It means that I have to work for it. It's not so much of, let's put it down to luck or personality.
It's like a match lah.
Yeah,
right?
yeah.
Yeah. I certainly agree with that. Actually, like whether or not it's a good fit, I think good fit is definitely something that we can actually work towards to having it. So it's like because we as like the provider of like the service, right, to actually provide the help, the support to the client. So like it is definitely the therapist's role to make sure that like you try your very best to be the good fit for your clients. So like with that being said about the therapeutic alliance one, so like I definitely agree with that. In terms of like how therapists, not just about being like what you mentioned, warm, empathetic, but it's also about like maybe in already like setting the posture to wanting to really just listen and hear what are the clients need. A lot of times it's like clients that actually they come in, they're probably like very preoccupied by the issues that they face. So it's like they are already very distressed. So they mainly come in just tell you, everything that they are going through, what happened to them. So it's like then it is really the therapist's ability or skills in being able to identify what are the unspoken needs inside like all the clients' narratives about what they actually spoken. So like I think the ability of being able to do so is actually very important. So they know at the end of the sessions or even throughout the interaction, then we can actually reflect back to the client, I sense that this is actually what you need, what you're experiencing, how you feel about it. Then they can provide guidelines on like maybe how we can actually make use of like this space in the therapy to help to address the concerns that you are actually bringing in. So like I think this is usually like the first touch, which is the therapist posture, being able to actually sit in with it and identify the unspoken needs.
So what you've mentioned is the sort of the first two parts of therapeutic alliance, which is if we could have a shared understanding on the tasks as well as the goals of therapy. And a lot of times when clients come in, depending we have clients who have quite good understanding of their concerns, but most times they're not, they are in a lot of distress, and it's going to that's the role of the professional. We need to clarify, we need to understand, in order to put it out on the table, what are the concerns that are being faced and what can we do about them, and how does future sessions actually look like, assuming that these are the concerns that you wish to work on. So the role of the psychologist in this sense is also to make sense of what you've mentioned about it, these unspoken needs, where the client actually gains a good understanding of, okay, so these are my concerns. I'm in distress because of so and so and so, and these are likely the steps necessary in order for me to actually improve in my functioning or to get better.
Yeah.
Which again, I think, personal stand is these are all skills that can be developed on the part of the therapist. Because you've also mentioned the word expertise. Some clients actually seek out the kind of expertise of the therapist, where if we have a good working knowledge of that particular concern, there's definitely going to be a lot more areas that we can help with rather than don't know much about the thing. Well, I've mentioned earlier, Serene, about how you tend to manage clients quite well in terms of their follow-up of the sessions. And you've mentioned about having a good fit between the therapist and the client. And we have discussed at some length about how this might be related to a variety of different factors, whether we are able to identify their needs, whether we are attending to them effectively, and also if we are being supportive, emotionally and being understanding and so on. But personally for you, I mean, if you look at your own personal experience in the sessions, you've seen quite a number of clients now. What is most helpful, you think, whether it's on the part of the client or on the part of the therapist, that will benefit the client in wanting to continue further in the sessions with you?
Yeah.
What are some of the observations here?
Observations. Okay, maybe I can mention, because of our clients, right? It's like they already come in with a lot of struggles, particularly, like emotional struggles. So they come in a very vulnerable state. That I would put it in that way lah. So they're definitely in a state that they really need the therapist to be able to hold the safe space for them. So when we talk about safe space, then definitely what the client actually wants to feel is that first I come in, that I can feel safe talking about my issues without the fear of being judged, and also I feel comfortable to continue to open up. That I feel okay, this therapist, it's very supportive and also very empathetic, and allowed me the safe space to express, so that I can trust that I can continue to open up more with this therapist. So with this being said, I think on my end, going back to the good fit that I'm thinking about just now, right, is that I know that of course, I cannot expect myself to be the kind of one shoe when they'll fit all size thing. I cannot be that. So I try my very best to really empty myself first before I enter the therapy room. So I empty myself, then I just go in. That's why I usually, in my first sessions, I will actually lay out to my client that this is their sessions. So it's they are the ones that are actually in charge or in control mainly, while I will be the supportive role. I'm facilitate and we will be working together. So it's not I'm the one to decide everything in that sense. So with this being laid out, a lot of the time in the first sessions, I already tell them it's I would like to hear everything that you like to share with me, and then I will relay back to you. If there are things that I relay back that are not accurate, then you must let me know, because it's getting the accurate picture of their situation is the most important one for me. So in the sense, if I know I said certain things that are not accurate, or maybe not something that actually what they really want or looking for, I also would encourage them to actually tell me about it, so that I can actually rectify about it lah. So that I can provide relevant solutions, or maybe a guidance of how we can actually work around with it. So I feel when clients hear that from their therapist, then they already feel safe. Oh, okay, even if because I think it's also because of our Asian context, I think, is that they are not very confrontational one. A lot of clients, maybe their first sessions, they're already, okay, don't want to come back, is because they feel the therapist didn't really get me, but I also don't feel comfortable enough. I feel shy, or usually we are not very confrontational. I also don't want to tell. I just okay, after first session, I just don't go back lah. Yeah, I think that would be something that I actually keep in mind lah.
So you brought up the concept of psychological safety, that people need to feel psychologically safe in order for them to actually self-disclose, or maybe to participate more meaningfully through the consultations. And you've brought up one of the key reasons, which is perhaps the kind of honesty that you demonstrate to your clients. And I do think that that is going to be quite helpful in order to develop that trust, because when we are honest and authentic, I think being authentic is a big thing in therapy. We are able to develop that bridge to connect with the other individual on the other side of the couch. And personally for me, I also do value honesty in the sessions. And I think to top up on what you've mentioned, honesty not only on the part of the therapist, where I'm able to communicate, for example, maybe the prognosis, which is the likelihood of treatment success, providing them with information that I think are relevant to them based on the empirical research, being really upfront about what I can and cannot do as a therapist, likely very important. But on top of that, honesty also in terms of what the clients feedback to me. So one great practice for therapists is to always elicit feedback of the session itself, because like what you mentioned about our culture being non-confrontational, a lot of times perhaps after the intake, the client isn't particularly happy about things that happen, A, B, or C, but it's not something that's expressed quite openly. So I oftentimes leave the last segment of every session to really elicit that kind of feedback from the client, not only on things that actually help, but more importantly, things that wasn't helpful, or things that can actually be improved. And I've become more, I think over the years, much more intentional and direct with that question. It used to be what's helpful or not helpful about the session. And nowadays it's just, was there anything that didn't go well in the session today? I like to take note of it so that we could do better the next session. So I think that kind of honesty and willingness to demonstrate that, hey, I really do want to improve on the quality of the therapy, so that you stay on and receive the full benefits. But it's really important that therapy were to continue. As you know, we also start applying some questionnaires in order to elicit some of their feedback on their satisfaction of the therapy as well, because I am very much interested to actually ensure that people get the services that they actually need. Now, Serene, aside from the variety of reasons that we've mentioned so far, are there any other reasons you think that could be helpful to actually improve on the follow-up rates of clients attending therapy?
You're referring to for the therapist part, or for the client's part?
It could be both. So it could be
both,
client
right?
factors, it could be therapist factors, could be therapy factors as well.
I think for the therapist wise, it's pretty much the posture of what you mentioned, being able to just be honest, be authentic, and be really open in receiving feedbacks from their clients, whether spoken or unspoken one. So I think this is how we already help therapists a lot, because then they are able to actually put it aside, that maybe insecurity of whether am I doing a good job or not. If they are able to put that aside, then really come from a posture of really just focusing on the clients, I think that itself will really help a lot already. So then maybe how can it be better improved? Perhaps for the client's part, I think I would really like to encourage for clients to to take ownership, because it's like this is really like their life actually, like whether or not this therapy journey going to be helpful for them, they're going to find it beneficial for them or not. It's theirs, like they're actually investing the time, the energy and the money in it. So it's like I would like to encourage them to take ownership of it and really empower them that they can actually voice out anything to the therapist. And in a matter of fact, I feel that if you take this leap of courage to already express or open up with your therapist, and if your therapist is not open to receive that, then it already show okay, meaning that this may not be a good fit for me lah, this therapist. So it's and if they were able to do that, the sooner the better, and this will also help them to actually improve their satisfactions throughout the journey as well.
So you brought up one therapist factor and one client factor here, and I find that with clients, what you're encouraging them to do is for them to be much more engaged and perhaps more actively involved during the sessions, whether things are working for them or not. That is freely conveyed to the therapist. But I find that in my experience of meeting clients, a lot of them come in with a blank slate. So they do not actually know that they can voice out these concerns, for example. They're just here, they don't know what are the steps, the procedures, what's the culture like in therapy. And so sometimes I find that it's not so much of the clients not freely expressing their views or opinions. They might not actually know that that is something to be encouraged in the first place. And that leads to the second point about the therapist factor. Because in order for us to effectively work with our clients, what we need to work on is really the issue of countertransference, which is the therapist getting in the way due to their own insecurities and whatnot, getting in the way of the quality of the therapy itself. Because if I'm referring to the literature review here, they cited a study where when the therapists are asked to investigate or evaluate why their clients drop out, they tend to focus on external reasons, such as external events or the client factors rather than their own contributions. Because this dropout affects them in a negative way, and in order to protect their self-esteem, they resort to explanations related more to, the client is not ready, or the fees are too expensive, so on and so forth. But I think it's really a matter of the perspective that we want to take on here. Are we in the job of actually helping our clients, and do we want to improve as therapists in order to help our clients? If so, then there's likely going to be some work needed psychologically on our end, perhaps through our own therapy or our own personal development, in order to address this particular issue.
I definitely agree with that. So what you mentioned, of course, these factors, they do exist. A client do experience some challenges or limitations. Definitely they do. It's very normal to actually have these kind of factors as well that happen in our practice. Perhaps what you mentioned, I think then it resides with the therapist role to probably can actually open up about these things. It's if clients have any challenges continuing the therapy, be it financial issue, or maybe their lack of comfort to actually talk about certain things, or not readiness to work on certain things. So I think a therapist, if they can pay more attention by observing maybe some of the hesitations or ambivalence in client, they can actually gently point it out to the client and then encourage them to actually normalize that these factors actually do exist. And if there is any, feel free to actually talk to me about it, so they know I can actually provide a few options that best fulfill your needs lah. So I think this part in itself, I definitely do agree with that. So with regard to what you mentioned about therapist fears and insecurities, I think it happened also, especially with probably maybe fresh graduate, like a psychologist who just started their practice, I think this is actually very common fear and insecurity because we just came out from like the evaluative context, like that, are we actually competent enough already or not? I think that is actually the part, because it's like once we already graduated, meaning that then we no longer receive that kind of support or training from our supervisor. So then of course they will very much having this fear, not sure whether am I already ready or am I competent enough to actually be on my own to actually deal with my clients, to help my clients or not. So when they come from this, then inevitably of course then they will actually sometimes can be preoccupied, or even might actually be taken aback if clients didn't come back, or client have a certain negative responses. So regarding this part, experience wise definitely take a role in it. While I think normalizing this part and also at the same time reminding ourselves that while when we actually be self-conscious about this part, I think what clients actually usually want the most is that not so much about whether how experienced you are, but more about whether are they being heard or not. So when we are actually preoccupied, then of course then we cannot be fully present with our client. So that would be my take for this part. What do you think?
Whether or not I think we can be present with our clients. Again, I'm going to go back to the issue of skill. Because all of these things, although it might appear to be rather subjective or perhaps hard to measure, but these are the same things that we actually train ourselves for. How present we are in terms of listening to what the clients are saying. And this comes down to certain practical skills. How do we ask questions? How do we paraphrase? How do we summarize? And so on. And in event of any emotional disturbances that gets in the way of the therapist being present. And I think that is something to be addressed as well. Some practical ways to address that is to actually get supervision. Or secondly, if they were to address this through their own personal development sessions, whether it's counseling and so on. Because all these are issues that gets in the way of how therapists work with their client. You're right that a lot of students, once they have graduated and become psychologists, they no longer receive the support, or rather mandated support or supervision. But it doesn't necessarily mean that supervision ends there. Continuous education continues even after graduation, and so does supervision as well. Although whether or not someone takes that at this point in terms of our legislation is still optional. But if someone is really, I would say, distracted or afraid of client feedback, then that is definitely a counter-transference issue that needs to be worked on, as otherwise it impedes their own development as a therapist and it gets in the way of actually providing good quality services to the clients. So that's my take. For the most part, I'm still very much on the position that it has a lot to do with the therapist skill. Although it might appear that the client is unsuitable or the presenting concerns might be, too different, so on and so forth. At the end of the day, it really comes down, for me, to the therapist's competence. But you had provided a recommendation to the client to be more actively involved in the sessions. And I think that's a very valid recommendation to provide to prospective clients. But I think to really wrap up what we've discussed today, we focus mostly on some of the factors that might contribute to client dropout. But what about clients in general? Now, let's assume that someone is considering accessing mental health services, maybe meeting a psychiatrist, psychologist, counselor, and so on. And they might be feeling jittery or anxious about making that step. What do you think would be a good recommendation, perhaps as a closing, on what do you think they can do in order to increase their chances of having a good session?
More satisfactory experience, right?
Yeah.
Actually, now that you mentioned this, I do. It reminds me of like because usually when I work with my clients, the very first questions that I would check in with my clients would be like to check in whether is this their first time or not, because whether or not it's their first time or they have had prior experiences with psychological services, that would be a very important point for me to zoom in. Okay, if this is their first time, meaning that like then they might not have a good grasp of like what psychotherapy or psychological services is like, then like I would take maybe more time or slow down the pace to actually walk them through what they can expect and how it usually be conducted so that they can feel safe and comfortable going with it. Then like usually with a more experienced client, then I would actually usually ask, how are your previous experiences are like? So what are some of the reasons that I actually stop the therapy sessions or services like this? So then from there on, you'll be able to tell what they're actually looking for, what actually worked for them and what actually didn't work for them. So, and with this, I think based on some of my experiences that I have collected thus far, I noticed that maybe there's actually one thing that's actually very important to mention is that which is that may actually help with the therapist's insecurity also, is that we need to remind ourselves therapy progress is not linear. So it's not okay, once they come in, then we expect the progress or the improvement is it will be better than the previous sessions and it will be better over time. So I think it's very important for therapists and clients to have these realistic expectations that therapy progress or healing progress actually usually is up and down and up and down. So it's when certain things don't work for them or they're stuck in certain situations or didn't obtain the progress that they expected, is to actually know that this is actually very normal and very, very common. Because I've had quite a number of clients who shared with me that they actually stopped attending previous therapy is because they feel that they didn't make the progress that are expected in the journey. So then they drop out either because they feel frustrated or that they feel embarrassed. They feel embarrassed because they feel like they have failed or disappointed their therapist and they don't dare to actually share it out. So, it's been a while also that they kind of fake the progress by telling I think it's been getting better, but actually it's not. So some therapists, when they also feel that the client is not making progress, then they got frustrated also. So all these things actually can be felt in the room. I think this is a very important factor that I can think of as of now to mention it, because it's not just about the first session that drop out, right? Also throughout the therapy. So I think this part in itself is actually quite important.
So I think this applies both to the therapist and the client.
Yeah.
So having the expectation that progress in therapy is not something that is linear. There's going to be some sessions where they might feel worse off than other sessions. So that will be a recommendation on what a potential client should keep in mind. But I think to really tie into what you've said previously, it's going to be quite helpful that clients actually express this frustration or this fear and anxiety about the therapy itself to the therapist. And on the part of the therapist, I suppose, is to be able to skillfully manage that rupture in the relationship or rupture in the therapy sessions once a client has taken that step to actually bring it up in the session. And that might involve, I think, on the part of the therapist, more long-term work, such as working with their own insecurities and self-esteem. Because if someone doesn't really have a healthy self-esteem to begin with, as a therapist, they might not be able to take this kind of feedback really well, and that disadvantages everyone.
Yeah, things may become personal when it is actually not lah.
Yeah. So thanks, Serene, for your final word to the potential client who might be accessing services anytime soon. Glad that you have joined us in our podcast today, and for the audience out there, very likely you'll be seeing Serene every now and then in our episode of Be Kind to Your Mind. Thanks.
Thank you.
Thank you for tuning in to this episode of Be Kind to Your Mind. Be sure to catch us again on Spotify or YouTube every 2 weeks. By the way, we are also open to providing psychological services. So if you or someone you know needs it, feel free to reach out to us. See you again in 2 weeks' time.